As a physiotherapist, I treat many patients suffering from pain due to physical strain. These patients, for example, industrial workers and caregivers. But I not only want to treat those patients, I also, as a physio nerd, want to prevent the symptoms from returning. So I tried and searched for methods and guidelines decades ago. And so I came across the 23 kilogram limits, the maximum weight a healthy person may lift. Lifting more than this could be harmful for your health. And the Netherlands wouldn't be the Netherlands if we made this to a standard, the lifting standard. The awareness of healthy working practice emerged so in the 1980s. In the same period, this lifting standard came on. This lifting standard describes how many kilograms a person may lift, at what height, and how far away. It's an industry standard. This standard applies of the movement of crates and boxes. Those crates and boxes must therefore be dimensionally stable and sturdy. They must have clear handles, and they may not contain any liquids and/or gases. The standard is made on average employees. And although this standard is not to be meant to use in healthcare, we are starting to use it there anyway. This has resulted in the painful paradox. Working in healthcare is working in one of the most unhealthiest sectors. This all because we are using the wrong standard. Healthcare is not industry. We are service providers. We do not move crates and boxes. We are moving people. People and boxes are totally different. People, as far as I know, don't have handles. People are shape-shifting, and people are a mixture of liquids, solids, and gases. And when it comes to movement, every person moves different. The crates and boxes mindset has manifested itself for decades. And mechanical approach yields to mechanical solutions. So we introduced lifts in all sizes and shapes. We have named turntables, and we have introduced sliding boards. Patients has therefore behave themselves accordingly. Uncooperative, no cooperation, no participation. If I'm treated like a box, I will behave like a box. But humans are no static loads. We are dynamic. We need movement to be healthy and to stay healthy. Lifting is hard work for the staff, and it takes the patients the opportunity to move themselves. Lifting is therefore not normal. We simply do not understand how people move. What you may not know about me is I am a passionate amateur dancer. And it was while dancing with my wife that I had this eureka moment. Dancing is moving together. I guide her on the floor. I want her feet to move across the floor. And I want to ask you, have you ever seen a dancer lifting the feet of his partner across the floor? Neither have I. So what's the difference? The difference is, as a dancer, I grab my wife by her arm and her shoulder, and I guide her gently across the floor. She is moving naturally, without effort. To explain the difference between dancing and lifting, I need to explain a little bit of physics, but don't worry, I will do it easy, simple, and understandable. In physics, a body, a crate, or a box is defined as mass. And the mass is standing on something. It's standing on something. In my case, the stage. And the force which a mass exerts on a support surface, that's called weight. And weight only exists there where a mass is in contact with the support surface. In my case, those 2 feet. This means that the rest of my body is free of weight. Well, that's interesting. When lifting, the focus is on weight. When dancing, the focus is on moving free body parts. Well, I want to show you what this means for the everyday. When I'm standing on one leg and I try to lift this leg, sorry, but that's impossible. What I do is move these 3 body parts to the other side and I can move my leg. That's how dancing works. And I want to do a little experience with you. And I hope you make it with me. You are sitting on the chair with your pelvis. There's this big bone over here. There is at this moment your weight. And I want you, and I ask you, I want to please stand up for me, but you have to do one thing. You have to start standing up with your pelvis. Not your chest, not your head, not your arms. You have to try to stand up with your pelvis first. It's impossible. But what you can do as a normal person is you can lean your head forwards, you can lean your chest forwards, and what happens? All the weight is away from your pelvis, where it is? On your feet. And that's the only possibility to stand up. Well, there was an interesting thing, and I thought as a physiotherapist, what would happen if I introduced this principle of moving free body parts into my work as a physiotherapist? What do you think? I gave it a try. What do you think? It worked. My body felt much better, and my patient participated much more. This is what I call a real win-win situation. Well, how does this look for me as a physiotherapist? Oh, sorry. I went to my patient, Mr. G. And Mr. G had a stroke. Sitting on his chair, tried to stand up. The nurse came, grabbed him by his pants, where he has weight, tried to lift him, what was physically demanding. Mr. G did not understand it, and he remained seating. The nursery grabbed in that moment. So the procedure said, she grabbed his lifting hoist, and wanted to let him stand up with the lifting hoist. And I said, stop. Then I came with my approach. I reached Mr. G a hand. He gave me his hand. He leaned forwards. And I try and helped him to lean further forwards, so all his weight is getting on his feet. And with a little assist of mine, he could stand up. And even walking with the walker was possible. My body felt not strained, but much more important is what he said. You have taken away my fear of moving. So what is the thing I want to tell you, and what is the thing I want you to remember? Stop lifting in healthcare. Introduce the principles of dance, moving free body parts. That isn't just only healthier, it's much more human, it's much more natural, and it's easier for both the patient and the caregiver. I would say, throw the idea of crates and boxes out of bed and bring in the principles of the dance, moving free body parts into healthcare starting today. Dare to ask the question, Mr. or Mrs. Patient, may I have this dance?